Before we begin, please like, share, comment, and subscribe to support more patient-friendly kidney health videos. Anemia is a common and serious complication in patients with end-stage renal disease (ESRD) undergoing dialysis. But how can we manage it effectively and safely? In 2025, Dr. S. Diamond published a pivotal article in Renal Replacement Therapy that challenges conventional approaches and urges a shift toward evidence-based practice. In a dialysis suite, care teams monitor treatments continuously. Anemia occurs when your body doesn't have enough healthy red blood cells to carry oxygen to your tissues. For people on dialysis, anemia is common and should be monitored regularly. Your doctor can diagnose anemia by measuring your hemoglobin Hb, the protein in red blood cells that carries oxygen. Regular hemoglobin checks during dialysis are essential. Common symptoms include low energy, pale skin, fatigue, cold hands and feet, irritability, brittle nails, unusual cravings like ice or dirt, pica, poor appetite, dizziness or headaches, trouble sleeping, shortness of breath, difficulty concentrating, a rapid heartbeat, feelings of depression, and restless legs. Not everyone has all symptoms. Report any changes to your healthcare provider. If you notice these signs, ask your doctor for a blood test. Early detection and treatment, such as iron supplements or erythropoiesis-stimulating agents, ESAs, can help manage anemia effectively and improve quality of life. Evidence-based practice means integrating the best available research with clinical expertise and patient values. Dr. Diamond's work highlights how outdated protocols, like rigid hemoglobin targets or aggressive ESA use, can increase cardiovascular risks without improving outcomes. We track hemoglobin, ferritin, and T-cell transferrin saturation on labs to guide safer therapy. To manage anemia effectively in dialysis patients, clinicians follow established guidelines, often using a combination of medications. The goal is to gently raise your red blood cell count, which helps deliver more oxygen throughout your body and ease symptoms like fatigue. Let's look at the two primary types of medications used based on current recommendations. First are erythropoiesis-stimulating agents, or ESAs. Think of these as a replacement for the natural hormone, erythropoietin, that healthy kidneys produce. ESAs essentially tap the shoulder of your bone marrow, signaling it to create more red blood cells. This process gradually increases your hemoglobin levels. ESAs include EPOH, tin-alpha, Darby, EPOH, tin-alpha, and Mircera. Long-acting stimulates red cell production. The second key component is iron supplements. Iron is a vital building block for hemoglobin, the protein inside red blood cells that carries oxygen. For ESAs to work effectively, your body must have enough iron available. Depending on your needs, your care team may prescribe intravenous iron, which is delivered directly into your bloodstream during dialysis, ensuring your body has the raw materials it needs to build healthy red blood cells. Here are the recommended targets for anemia management in dialysis patients. Guidelines outline targets and dosing ranges to tailor anemia treatment to you. Managing anemia effectively is a partnership between you and your healthcare team. Being an active participant in your care can make a significant difference. So, what should you do to contribute to your own well-being? Here are several key evidence-based actions you can take throughout your dialysis treatment to help manage anemia safely and effectively. First, know your personal hemoglobin target. While it can vary, guidelines often recommend a range between 10 and 11.5 grams per deciliter. It's crucial to work with your doctor to find the right level for you. Pushing hemoglobin levels too high, especially above 12 G/dL, has been linked to increased cardiovascular risks, so careful monitoring is essential for your safety. Next, monitor your iron status. ESAs need iron to build new red blood cells. Your team will order regular ferritin and TSAT tests. Think of these as measuring your body's iron storage and how much iron is ready to be used. These results are vital for guiding iron therapy and ensuring your ESA treatment is as effective as possible. Use ESAs cautiously. The goal is always to use the lowest effective dose that maintains your target hemoglobin level. This approach helps maximize the benefits while minimizing potential side effects, such as high blood pressure or clotting risks. Don't hesitate to ask your care team if your dose is optimized for your specific needs. Check your vitamin B12 and folate levels, typical normal ranges. B12 about 200 to 900 picograms per milliliter, folate serum greater than 4 nanograms per milliliter. For iron status, ferritin roughly 20 to 300 nanograms per milliliter, and transferrin saturation, TSAT, about 20 to 50%. Ranges can differ by laboratory. Follow your lab's reference and your clinician's targets. Report any new or worsening symptoms early. Things like increased fatigue, dizziness, or shortness of breath could signal that your anemia is not well controlled. Informing your care team promptly allows them to investigate and make timely adjustments to your treatment. Finally, and most importantly, stay engaged. Your voice is crucial. Ask questions, make sure you understand your treatment plan, and actively participate in every decision. You are the central member of your care team, and your involvement leads to better, safer outcomes. Dr. Daimon emphasizes that modern healthcare views patients not as passive recipients of care, but as active partners in their own health journey. This partnership is built on open communication. Your voice is crucial in choosing treatments that align with your personal health goals and lifestyle. It's about discussing what matters most to you, whether that's maintaining energy for work, spending quality time with family, or simply feeling your best. When clinicians and patients work together applying evidence-based strategies, the outcomes are powerful. This collaborative approach helps reduce cardiovascular events, significantly improves quality of life, and ensures the treatment is just right for your individual needs. Diamond's article is a call to action for both patients and providers to continually rethink and refine how we manage anemia in dialysis together. Anemia is treatable. Don't ignore the signs. Get checked and take control of your health. Let's move forward with care that's informed, safe, and patient-centered. Know the signs, get tested, and take control. Your strength starts with awareness. Thanks for watching. Please like, share, comment, and subscribe.